How can one diagnose selective mutism? Incredibly, people with selective mutism can go for years with a false diagnosis or with no diagnosis at all. They're sitting in the back of the class in a way they're the ideal student, often because they're not disturbing, they're quiet, scared, and often good students, often highly intelligent, in fact, usually. So how can it be diagnosed? Now, there are scores, there are questionnaires like the Selective Mutism questionnaire of Bergman and her colleagues, standardized, where you can measure, ask parents and teachers to fill in where and with whom the child or teen talks. However, how to really diagnose selective mutism is so simple. It is using a phone, which we all use. We all record our children all the time. And the crux of the matter of selective mutism is the difference between the child's ability to talk in certain places as opposed to his ability to talk in other places. So nearly always at home, the child is a bubbly or talkative or communicative person. And in school or kindergarten, they're a shadow of themselves. So when you see a video of the child at home, it can be taken even without his knowledge for diagnostic purposes. And then you compare it to how he's functioning in school. You can see how he is talking, with whom, what his language skills are, and compare them to how he is communicating in school, his social communication. So that is the crux of selective mutism diagnosis. I must say that you can have, along with selective mutism, other issues. Sometimes you find there are other anxiety disorders, OCD, separation anxiety. A lot of anxiety disorders can go together, and that's one of the reasons to treat very early. You do sometimes find autism together with selective mutism. Nevertheless, it should be treated. However, usually it is, in the vast majority of cases, it is a disorder that you can see quite clearly from the functioning of the child at home as opposed to the functioning in. Of course, when you do meet a child with selective mutism or with suspected selective mutism, and it can often be mistaken for autism because that's how it can manifest in school. A child who doesn't communicate, who is socially uncomfortable. But once you see how he is at home, then you realize that this isn't autism, because autism manifests at home and at school, perhaps slightly differently, but it is clearly there in every place where selective mutism is the difference between certain places. It's selective. So here I'm urging therapists and school staff, trust the parents. If they say, my child communicates well at home, trust them. And have a look at some videos just to see, also to see to the degree that there's a language difficulty or that there can be some other difficulties. So, this is a really, really valuable, this is my main diagnostic tool.